All right. So I want to do a review of some basic terminology. As many of you know, X-rays are ordered by a healthcare provider, right? Um, who's a healthcare provider? What do we mean when we say healthcare provider? Doctors are healthcare providers. Anyone else? Nurse practitioners, PAs, physician assistants, right? Anyone else? Chiropractors, DOs, doctors of osteopathology, right? So all these people, right, all these professionals are healthcare providers. They are licensed in the healing arts, and they can do things like order an X-ray, okay, order radiographs. What are radiographs used for? Right. So they're considered a diagnostic exam, right? That they're considered a diagnostic, right? And that means they can be used to diagnose disease, right? Because of that, we have specific positions called projections that will perform of different body parts. So let's get down some basic terms here first. Radiography is the act, right? It's the act of performing a radiograph, okay? The radiograph, as shown just below the term, is the image, the viewed image. That's our radiograph. And then our radiographic procedure. That's the exam that we're going to be performing. So we'll refer to it as a radiographic procedure, a radiographic study, an exam, and then offhandedly we'll refer to it as taking X-rays, right? But anyways, it's a procedure done to provide images to the healthcare provider so that they can use those images for diagnosis of what? Yeah, we're going to just refer to those things as diseases, right? Diseases can be acute diseases, chronic diseases, pathologic diseases, or they can be traumatic disease too, right? We're going to talk a little bit about traumatic disease today too. Every position or projection that we talk about is based on this. It's based on anatomic position, right? So just again, review for most of us. Anatomic position is standing, patient facing towards you, palms facing towards you, toes pointed straight ahead, and their feet are about shoulder width apart. In that position, you may know, everything facing towards you is considered their front, or the more correct term, their anterior, and everything facing away from you is their back or their posterior. Good. So we'll say anterior and posterior, right? Okay. To help us with some of the positioning terminology we're going to be using, let's remind ourselves that the body can be divided into what are called planes. Okay. Remember, we're taking good notes as we're reviewing here. Okay. So unless you don't need any notes, but what are called planes, right? Planes are divisions of the body, right? Ways to divide the body into things like a top and a bottom, a left and a right, a front and a back, right? And so just to list these planes off, we have the sagittal plane, dividing the body dividing the body left and right. More specifically, mid-sagittal, dividing the body equally left and right. That's the one shown in greenish. The coronal plane, shown in sort of a purplish color, dividing the body into a front and a back. The horizontal or axial, or most often just called the transverse plane, shown in the blue color, divides the body into top and bottom. Now what we'll do is, and those of us who have been in the X-ray room know that there is an X-ray tube, right, that creates an X-ray beam, okay? Then below the patient somewhere there is an image receptor, right, or a table surface with a detector in it, right? We're always going to be considering what relationship these planes of the body have to either the X-ray beam, the primary beam, central ray of the primary beam, the middle of the beam, or what relationship these body parts have to the image receptor. For example, in a PA chest X-ray, the mid-sagittal plane of the body, this one shown in green, is placed perpendicular to the receptor, right? But effectively parallel to the primary beam. The primary beam coming like that, right? That plane of the body with the patient facing, in this case, towards you guys, those two things are parallel to each other, right? So we're always going to be placing some plane of the body in some relationship to either the image receptor or the X-ray beam, okay? And what that's going to do is that's going to allow us to have different views, different perspectives on the anatomy that we're trying to demonstrate. You notice I skipped one, the oblique plane, right? The oblique plane can go at any angle that is not exactly 90 degrees to one of these other planes. Okay, so the oblique plane is nothing specific. It's just any plane that is not exactly 90 degrees from any of these others. It's kind of an in-between. Okay.